good afternoon. There we go, much better, much better. I want to thank you for joining me at South Suburban College as we open our third mass vaccination center. Before we get started, I'd like to acknowledge the people with us, both in person and virtually, who have made this day possible. Commissioner Miller, in whose district we find ourselves, Commissioner Sims in the adjacent district. We hope to be joined shortly by Frank Zuccarelli, who's chairman of the South Suburban College Board of Trustees.
He's here.
Frank is here? And he's on his way in. Good. Lynette Stokes, who's president of South Suburban College, and members of South Suburban College's Board of Trustees. John Daly, Jeanette Rogers, Terry Wells, Toni DiFilippo, Vivian Payne, and Joseph Whittington. I'd also like to acknowledge Lieutenant Mans from the Illinois National Guard and his crew who have, along with our health and hospital staff, made this center possible. And I would be remiss if I didn't also acknowledge our sign language interpreters, Mark Motika and Michael Albert. I want to begin by thanking Mr. Israel Rocha. Where is Israel?
I'm right here.
All right behind me. CEO of Cook County Health, and Dr. Rubin and Dr. Joshi, who are co-leads for the Cook County Department of Public Health. And most important, our Cook County Health staff, who worked tirelessly to get the vaccination sites up and running. Last week, we opened a community vaccination center at Triton College in River Grove, and the week before, a mass vaccination site in Tinley Park. And just yesterday, we were able to launch another site in the Southland dedicated to protecting our teachers and school staff. Thanks to these efforts, Cook County Health has administered 600,000 doses of the vaccine today. I take that back. 60,000. I wish it were 600,000. 600,000 people are the number of people who are eligible in 1B. 600,000 people, and so far we've vaccinated 60. We have a long way to go, and I ask you to be patient. I'm happy to join colleagues today as we open yet another site. I am grateful to Governor Pritzker for his support and deployment of the Illinois National Guard. There's no way that we could stand up these mass vaccination sites without the Guard. Again, I want to thank Lieutenant Mans and the folks from the Guard who are here. You've been critical to our success to date, and we appreciate your help and support, as I'm sure all the people who have been vaccinated appreciate your help and support. When I received my first dose of the vaccine in Tinley Park a couple weeks ago, I was impressed with the professionalism and compassion of these fine young men and women. I am grateful to you. Finally, I'd like to thank the leadership and staff at South Suburban College for working with us to open our latest vaccination center. Thank you for stepping up at our community's time of greatest need. And the need is great, especially in the Southland, where many of our brown and black neighbors have suffered disproportionately. I'm proud of the work being done to expand equitable access to the COVID-19 vaccine for the residents of Cook County. But as a reminder, we still do not have enough vaccine for everyone who is eligible in phase 1A and 1B. We continue to ask for your patience and to bear with us as we ramp up our efforts in partnership with the federal government and our local partners. I assure you, we're building capacity so that when more vaccine becomes available, we can immediately increase vaccinations at a rapid pace. We're committed to vaccinating as many Cook County residents as it takes to turn the page to the next chapter. Every day we get closer and closer to putting our current chapter in the history books. Today, another page turns. Again, I'm very grateful to the Guard and to all of our health and hospital staff who have joined together to make this site possible. All right, we're going to hear from a number of folks today, and I'm going to ask that each of you take the podium in order so that I don't have to return here every time. Commissioner Miller will be first. This is your district. Commissioner Sims, Supervisor Zuccarelli, and then Israel Rocha. All right, let's begin with Commissioner Miller. Thank you.
Thank you so much.
The mic.
Thank you so much, Madam President, and good afternoon, everyone. I'm Donna Miller, Cook County Commissioner of the 6th District, and it's a pleasure to be here. I want to thank Cook County Board President, as well as the Cook County Hospital and our National Guard and South Suburban College for this center and inviting us all here today. I'm really happy to be here. Although we're on the road to recovery, it does not replace the hard path that it took to get here. Today's COVID vaccination center really hits two important fronts. We need to address that the regional disparity is present and people being able to access the vaccine confidently and conveniently within their community is important. I think it's indicative from the leadership that we have and the officials gathered here this morning that in Illinois, at least, we've all been working together on all levels of government to make sure that we are fighting against COVID-19 since this pandemic began. And we want to protect our most essential aspect of this rollout is making sure that people have it. I've mentioned it many times that the South Suburbs has been particularly hard hit during this pandemic, and in fact, in 2020 alone, we had 1,100 deaths. 38% of those were Black, and those were in the 6th District. It amplifies the unprecedented level of disparities in healthcare outcomes during COVID-19 pandemic, especially in the Black and brown communities in Cook County and throughout the country. And it's why it's so important that we ensure a vaccination plan is administered in an equitable fashion. So South Suburban College is an ideal location for a community vaccination site, and I'm hopeful that the supply of vaccines becomes more readily available and more test sites, both large and small, will come online, and we'll make a concerted effort to have vaccine access points in neighborhoods, hard to reach residents where they're impacted by COVID-19. So I've been hearing a lot of misconceptions still in the community about vaccines and how difficult the rollout has been functioning, but it's important, as President Preckwinkle identified, that we all maintain patience, and we also continue to educate our residents. We're lucky to have vaccines with such a high rate of efficacy and safety, and in such a short time, but we can't stress enough the importance of following the science and data that's been overwhelmingly positive as it relates to vaccines, and we must ensure that as many people who want the vaccine have access to centers just like this. So I encourage everyone to get vaccinated when it's their turn. I've signed up on our Cook County website, and I'll be anxiously awaiting when my turn comes up. And I encourage everyone to do the same. So thank you. I look forward to continuing working with all of our leaders in the community and the members of the South Suburbs and beyond to finally overcome COVID-19. Commissioner Sims.
I'm going to take this off. Good afternoon, everyone.
Good afternoon.
First of all, I want to say thank you to the governor for letting the National Guard come in and administer the shots. I'd like to thank President Preckwinkle. I'd like to thank President Preckwinkle's staff, and I'd like to thank Frank Zuccarelli. You know, when there's a time of need, you can always count on Frank to step up, participate, and take the helm and try to make things happen. I know when he called me and asked me, well, where's South Suburban College in the mix? We want to make sure that we're vaccinating people. He got on the phone and he got busy and he started talking to the president's people, and this became a reality. I, like the president, have had my first shot. I will get my second shot on the 25th. And I want to tell everybody, I'm one of these people that don't follow my lead in this one. I don't take the flu shot, but I was determined to take the COVID shot. I think in order to protect everyone else, it was my duty to make sure that I took the shot. And I want to say, I'm afraid of needles. And the person that gave me my shot was a National Guard. So I want to give a round of applause to all of the National Guards because they give some good shots. Because you know, if I took a shot and I'm afraid of needles, then she did good work. So I want to thank her for giving me my shot. And to all of you that are here today, make sure we tell the seniors, you have to take the shot. That's the only way we're going to tackle this monster. This is bigger than anything we've ever had in our lifetime. And it's going to take all of us to pitch in and do our job. Even though if you're afraid of needles like I am, and I'm in good company because Dr. Gupta is afraid of needles too. So if I can take my shot, I think everybody else can take a shot. So thank all of you for coming out, getting your shots, and let the National Guards administer these shots. And President Preckwinkle, thank you for being so aggressive and trying to make sure we do this. And thank you, Frank, as well. The next person is, who's next? Oh.
Frank Zuccarello.
Frank, you're next.
Hello, everyone. How are you all?
Hey, Frank.
At least we're warm in here. I know there's people waiting outside to come in, so we want to try to get going pretty quickly. I first want to thank President Preckwinkle, as well as our county commissioners, Donna and Deborah and Stanley, who's not here this evening, and of course this afternoon, and President Preckwinkle. Everybody working together, that's what makes the difference. But I've got to tell you, they always say, get a hold of Frank and he can figure it out. Well, you know how I figure it out? I called Janet, I called John, I called Terry, I called Toni, and I called Vivian. I called and Joe. All of our board members I called, so it's not a surprise for them. They're used to us all working together. And you know what makes this work is when we call the president, she responds. She knows that we're for real. If we say we'll be here, we'll be here. Our coach up there, our basketball coach, is up over there looking down at us because his team has to play someplace else for a while. They're going to be practicing and doing all that because South Suburban College belongs to this community, and we're going to work with you every single day. The reason we do well is because we do well with each other. We couldn't do it without everybody, and of course, I tell all the board members, we tell her what to do, and then this is the president of our college. The littlest one, but she's the strongest one. She's always the one that tells us, well, I don't think that's a good idea. And then we tell her, well, yeah, we think this is a good idea. She's a great president. Please give our president, Ms. Lynette Stokes, a round of applause. Thank you, Lynette. We all work together, and we work together. We've got great legislators. We've got great county commissioners. We've got a great president of the board, and that's why we get things done, because we work together. Thank you all very much for coming, and we hope we don't disappoint you. The first couple days are going to stumble a little bit, but we're going to get moving, and we're going to get going quickly. And I know that the president and all the commissioners really want to do a good job for you, and so do all of our colleagues here at South Suburban College and Thornton Township, but we have to do it together. So thank you all for coming. We'll try to get moving as quickly as we can.
You're next.
Good afternoon, everyone. Thank you. I'm very, very happy to be here. It is a very humbling experience to be here because we're standing up another one of our large sites. I want to begin by thanking President Preckwinkle, our commissioners who are here with us today, all the elected officials and the leaders for helping to work in cooperation to bring today's site and make it a possibility. I also want to thank the governor and our troops for their ongoing commitment. The governor has helped us to be able to secure the Illinois National Guard to be here, and you've heard the wonderful and excellent work that they're doing, not only by helping to vaccinate everyone that comes through our doors, but also to provide compassion and comfort in each of those episodes. The Guardsmen and women have been a pleasure to work with, and all of our patients always comment about what an amazing job they are doing. Today we're here, and so want to share a little bit about the numbers, about what our South Suburban site is here to do. So this site actually is built to be able to accommodate up to 800 vaccinations a day. We're hoping to get to a little bit over 500 today as we continue to ramp up. But as you've heard, a lot of that depends on vaccine, and that's really what we're also talking about today. Unfortunately, I have to continue to give the message that we ask everyone to please be patient, to understand that the amount of vaccine that is coming is something that we're working on. We're being diligent. I know that the president every day advocates at the beginning, at the end. Our commissioners, all our leaders, our elected officials are pushing to make sure that we get more vaccine. And so we ask everyone to continue to please be patient. We are standing up. The centers, we are continuing to move, and we are making sure that whatever we have, we go forward and giving our appointments. But this unfortunate news is the vaccine supply is extremely limited at this time. And what this means is that just like other states in California and New York, we've had to maybe not operate all the days that we're going forward. So over this weekend and a little bit through the holidays and a few other days, some of our sites will not be open on the regular Monday through Saturday cadence that we had committed to, and we're continuing to be able to do that. But we're committed to also ensuring that when you get an appointment, you have a vaccine, and that's really what we're working for. So we have to monitor our schedule, and we have to look at what we're doing, and why this program continues to open. We've got a question, why are you opening new sites? And the reason is that we've been given assurance that we are going to be getting more vaccine that is coming forward. The one thing that we've also heard from everybody who's communicated with us, they want the vaccine yesterday. So our job is to make sure that we are here, that we are ready, and that we're able to distribute with multiple sites that can accommodate up to 800,000, some in the many thousands a day. And overall, our program can start to hit 10, 20,000 a day is our goal. When we do that, we will be able to vaccinate as we get more supply. That's why you continue to see us grow. You're here in operation. You see individuals getting vaccinated. Every person represents one less person who is now more secure, one less person who's going to be able to get COVID, who's going to get the severe symptoms that they have, and who will go through a new experience and hopefully a greatly reduced risk at COVID. And that's what every person who goes through our centers mean, and that's what we're committed to opening them in a geographic manner, in an equitable manner, ensuring that we're doing everything we can for the county. So again, we remind everyone this is not a marathon, it's a sprint. We continue to work with us to be patient, but to also see that we are getting vaccinations in arms. We are creating the distribution center, and that means that there is hope hopefully coming soon. So when we ask you to be patient, and we ask you to work with us, we understand that that gets frustrating. We understand that there's concerns and we care about our family. We give you our commitment that everyone who wants a vaccine will be able to get one. And we're going to do everything possible to do it as fast as possible, and that's why we continue operating, creating that supply. So the minute that we get the vaccines, we put them into arms. We want to thank the community, we want to thank the leadership, but most of all the community for working with us, for being patient, for understanding this process, and willing to continue to work with us to make sure that we get vaccinated. I also want to thank Chairman Zuccarelli for his assistance here in the leadership of South Suburban College, their willingness to allow us to partner, to be able to give vaccinations across Southland, and to make sure that we have access points throughout the county in a geographic and equitable manner. So thank you everyone today. It's an exciting day. We now can be able to give up to 800 more a day, and every day that we open a new site, that's why we keep asking you to come by, it means that we have one more area that we can get more patients through faster, and we just keep hoping that that vaccine news comes very soon, that we'll be able to not talk about thousands, not tens of thousands, but hundreds of thousands that we'll be able to put through as quickly as possible. So thank you everyone, and again, thank you to the leadership, to President Preckwinkle, all of our commissioners, the leaders, and everyone's here today in South Suburban College. Thank you so much.
Thank you. All right, are there reporters in the room who have questions? Yes. Yes.
Hello?
Okay, excuse me. If you're on the line, could you wait just a moment and we'll hear from people who are with us. I'll repeat the questions for your benefit. Try again, Charlie. All right, the question related to the governor's statement yesterday expanding eligibility for Phase 1B to those with comorbidities who are 16 to 64. That's the question? I want to say that we've administered the vaccine as fast as supply would allow, and now we're in the same situation as LA County, where we'll be temporarily closing sites because we've exhausted our current vaccine supply. While other parts of the state may be ready to move into the next phase, Chicago and Cook County are not. There are 600,000 individuals eligible under Phase 1B, and you heard earlier that we've vaccinated 60,000 people in Cook County. So 600,000 people are eligible under Phase 1B, and an estimated 1 million people would be available eligible in the next phase. Cook County Health has administered nearly 60,000 plus doses, and it's only a fraction of what we need to get through Phase 1B. We're equally as frustrated as the community with the lack of vaccine, but we'll continue to stand up sites to be able to immediately respond when there's more vaccine available in the weeks and months ahead. Expansion to a larger group at this time is simply not fair to those who were prioritized by the Centers for Disease Control and Prevention. At this time, we simply can't even predict when we'll be ready to move beyond those 65 and older and essential frontline staff. We remain committed to providing vaccine to as many individuals in Cook County as we possibly can. And again, we ask for your patience. Does that answer your question, Charlene? Yes, at this difficult moment, I try to remain hopeful. However, I just recall that on December 16th, when I was at a press conference with the governor and we were talking about beginning to distribute vaccines, he informed us that he'd gotten a call from Washington that morning, and they were getting 40% less vaccines than they were promised. So the volume of vaccines and the consistency of the vaccines has been a real challenge for all of us at the local level trying to administer them. And so unless and until we have vaccine in hand, we're not going to make appointments for people when we can't meet those commitments. All right, any other questions in the room? Yes? I'm sorry, say it again. Josh, okay. Israel, do you want us to answer the question?
Sure. Correct. We're going to continue our operations throughout the county, so we'll confirm to you with the schedule in the different locations and what may change. But we're continuing to do contact tracing and testing, so we'll get back to you on the confirmation of this location. I want to just confirm to make sure that operates. I want to confirm to you again. I want to make sure that we, again, don't want to give you misinformation. I want to validate what is going on.
All right.
So it is testing right now at this time, but we want to make sure
Yes, we currently do have a testing facility. It's right adjacent to us. It's been a heavy flow of traffic. It's something that the community needs, and we are confirmed with that contract through the end of this semester.
And when is that?
May 1st.
All right, so in response to the question, we will be continuing to do testing here at South Suburban College. We have a contract. South Suburban has a contract to do testing until May 1st, the end of the semester. Okay? All right, anything else, Josh? All right, on the line, who do we have?
This is Mark Koppel.
Mark, okay. Mark, what's your question?
I have two questions, actually. One for Superintendent Zuccarelli, one for you. And the first one for you is, are you worried that, the governor's announcement about people with pre-existing conditions being qualified is going to create even more of a bottleneck for making appointments? That has been a trouble, that, people won't hear your message, that it's not happening in Cook County, and it's going to create a problem for senior citizens?
All right, the question is, what's the impact of the governor's announcement yesterday opening up Phase 1B to people 16 to 64 with pre-existing conditions. All I can say is in the city of Chicago, in the county of Cook, we don't have enough vaccine for the people who are already in 1B, that is senior citizens 65 and older and essential workers. And we are prioritizing them as the Center for Disease Control and Prevention has outlined and guided us. All right, what's your second question?
I was actually talking about the appointment system. I'm sorry to interrupt.
Yes,
The
what's your...
appointment system has been troubling. So just like,
We have, here's the thing.
Is that a cause for concern because you made this announcement without telling you about it?
We are only making appointments as we have vaccine, because we don't want to have people come to our sites and be unable to be vaccinated because we don't have sufficient quantity of vaccine. Both our website and our call center have been inundated with calls from people who are anxious to be vaccinated, and that was prior to the governor's announcement. That's all I'll say. All right.
Superintendent Zuccarelli.
All right.
Good to see you, Frank.
Yes. Okay. Superintendent Zuccarelli, there's a question for you. Just a second. Hold on, sir. Hold on, just a minute.
The mass vaccination site opened up in Tinley Park. Is that when you started making calls to get it down in the South Suburb, to get one open in the South Suburb?
The question relates to when Supervisor Zuccarelli started making calls to try to ensure that South Suburban was a site for vaccination.
About a month ago. And it didn't take long, though. They're all working together, and they've done that. South Suburban's got quite a reputation for working with all of our local governments, and the county is no exception. They've been great with us. It's easy for us to work with them, easy for them to work with us. So it was about a month ago, but it didn't take us that long. Our county's been very responsive, and we appreciate that very much.
Thank you, Frank.
Thank you. Did you have any other questions?
That's all.
All right. Are there others on the line? Going once? All right. Here's a text question. All right, the question relates to a statement by Dr. Fauci that by April, vaccines will be available to everyone because we will have, in addition to the Pfizer and the Moderna vaccine, a Johnson & Johnson vaccine, and hopefully an AstraZeneca vaccine. I am in no position to contradict Dr. Fauci, so we'll let his word stand. Any other questions? All right, thank you all.